It's something Brooke Sears will always carry with her. The memory of her voice going unheard, her symptoms being invalidated as she sought a diagnosis for her Polycystic Ovarian Syndrome, otherwise known as PCOS. PCOS presents differently across patients, but for Sears it meant acne, irregular periods, hirsutism, and extreme difficulty losing weight.
I just was not understanding why I was failing at this, just felt like a failure all the time.
Growing up in New Brunswick, Sears was bullied for her size and repeatedly put off by healthcare professionals.
Indigenous women are especially not considered in the healthcare system, but at the same time where I am, a little bit more white presenting, as much as I hate to admit that is a bit of a privilege, it is. But I strongly feel like if it had come up, it probably would have resulted in problems.
It wouldn't be until her early 20s, when she was referred for PCOS testing in Nova Scotia, that Sears got a glimmer of hope. But her experience with an OBGYN in Cumberland County was far from encouraging.
I believe she saw that I was overweight and she tunnel visioned on that. I told her, I said, "Doctor, I eat 800 calories a day and I do intense cardio for an hour a day, 5 days a week. I might lose a pound a week at best." And she looked at me and said, "Surely you must be doing something wrong."
Sears says she was handed a low-carb bread recipe and sent on her way. But experts say when women tell their medical providers they're trying to lose weight and nothing is working, they really need to listen.
This is not something where it's just a diet or just exercise. A lot of PCOS patients need medical management.
2 years later, Sears was finally diagnosed with PCOS, but she says Maritime doctors' hyperfixation on her weight contributed to disordered eating habits that were challenging to shake. Researchers estimate about 1 in 10 women have PCOS, but that number could be far greater as many go undiagnosed. PCOS patients are 3 to 6 times more likely to develop an eating disorder when their concerns are dismissed.
There was a philosophy in emergency medicine that you assume a woman is pregnant until proven otherwise. And there's a statistic that about over 6% of women who present to an emergency department will find out that they're pregnant and don't even realize it. An average of 10% of North American women have PCOS. So in primary care, every woman should be assumed to have PCOS unless proven otherwise.
Due to the challenges in getting diagnosed, many PCOS sufferers look outside the Maritimes to get care.
I get patients from New Brunswick and from Nova Scotia reaching out to me, wanting me to treat them. I get calls every month.
A shortage Zaboral attributes to a lack of education surrounding women's reproductive health in Eastern Canada and beyond.
Nova Scotia is not known for a sophisticated healthcare system. The province consistently ranks among the lowest when it comes to healthcare performance.
A lot of us with PCOS, first of all, we have to be our own advocates and we have to be our own researchers in this because they are not going to help us.
Ella MacDonald, Global News, Riverview, New Brunswick.